This is mini lecture 3B, and we'll begin by looking at human needs. We need to understand human needs in order to understand human behavior. One model of doing so is Abraham Maslow's hierarchy of human needs. It's been used for many years to better understand patients. Its assumptions are being questioned today, but you may still find it to be a useful framework. This is Maslow's hierarchy of human needs, and you can see there are different levels. Level 1, physiological; 2, safety; 3, love and affection; 4, self-esteem; and 5, self-actualization. True or false, it's necessary to fully meet each need on Maslow's hierarchy before moving up to the next level, and that is false. We move up, we move down. Illness and injury can alter human needs, and full recovery may involve moving up this hierarchy. I think what it's important for healthcare professionals is to understand that the human being does strive to meet the needs at each level. We also, in understanding or attempting to understand human behavior, need to look at defense mechanisms. Defense mechanisms are responses to perceived threats to our self-esteem, and they do serve a purpose. They provide relief, at least temporary, to the mental discomfort and anxiety that these threats cause, and they are commonly used. There are a list of defense mechanisms in your textbook. We'll run through them quickly. Compensation is substituting something. So you meet a need through substitution. Perhaps you've had a difficult breakup, so the human need of love and affection is threatened, but you'll substitute, as this young woman is, some ice cream. Control is using inappropriate control to make up for loss of control elsewhere. This tends to be my go-to defense mechanism when my world is shaken up, when I'm facing something very, very difficult. I want to make sure the silverware in the silverware drawer is in order. Okay, so it's not appropriate, but it's making up for loss of control. Denial is pretending something is not true. Displacement is transferring feelings about one person to another. Maybe your supervisor is driving you crazy, so you come home and you yell at the kids. Acting out is extreme behavior, as this young man is acting out. Malingering is pretending to be ill. Projection is when you see your weaknesses in others. Rationalization is explaining away the behavior. And regression is moving back to an earlier age, the behavior of an earlier age. Repression is keeping memories out of awareness, and withdrawal is refusing to communicate with others or participate in social activities. In the healthcare professional, if the healthcare professional suspects a patient displaying a defense mechanism to deal with fear, it is best to show interest in the patient's well-being. So you need to understand that the patient is dealing with something, demonstrate acceptance, listen, and provide information as needed. Losses are common in healthcare. Okay, our patients have to deal with loss. It may be the loss of good health, it may be the loss of independence, it may be the loss of a loved one, and loss can significantly influence patient behavior. Healthcare professionals can help patients deal with loss. We need to understand its significance and give patients the opportunity to share their feelings and help them explore ways to deal with loss. There are a number of different ways. No one method of dealing with loss is better than the others, but seeking help from family and friends, comfort in religion, drawing on your own person and self-esteem, employing problem-solving techniques, defense mechanisms, becoming angry or depressed. Remember, we are treating patients as individuals, and the effectiveness of healthcare professionals depends on understanding those differences. Patients have different perceptions of the healthcare system. We need to watch our patients. We need to watch their behavior. We need to listen to them, determine whether language barriers are present, and ask questions, of course. And then we need to listen carefully. Some patients need more information than others. We need to explain what we're doing and why. Is it appropriate to ask patients directly about their healthcare beliefs? Absolutely. It should be done in an inquiring manner rather than a judgmental way. Okay, on to the response.